Well, hello and welcome to today's lecture on vascular ring anatomy. So this is the first in a series of videos that will cover embryology, anatomy, and management of vascular rings. So first, let me take a moment to orient you to our virtual reality anatomy system. In general, we use both idealized models and imaging data sets from real patients side by side to illustrate concepts and specific anatomies. Under each model, you'll see a compass we've inserted to help you orient yourself to the patient with superior, left, and anterior directions labeled. And with that, I'll go ahead and move our model here on the left a little closer so you can see the compass. As I move this closer, we wanted to reiterate that a big part of the objective of this lecture is to help learners really understand the spatial positioning of the structures involved with vascular rings. So as we move through this lecture series, pay particular attention to the relationship of the structures involved in these rings and in normal aortic anatomy, as those will be critical to the objectives we want you to learn. And I'll go ahead and put this back. And with that, I'll go ahead and move to the remainder of our objectives. First, we'd like our learners to understand the embryologic development of vascular rings. Secondly, we'd like you to understand the typical clinical presentation and workup for symptomatic vascular rings. Thirdly, we'd like you to understand the most common vascular ring anatomies. Fourthly, we'd like you to understand the spatial positioning of structures involved with the most common vascular ring variants. And finally, we'd like you to understand the basic treatment strategies for the reviewed vascular rings. So with that, let's go ahead and define our terms. So what is a vascular ring? Well, it's by definition blood vessels which encircle and compress the tracheobronchial tree and or the esophagus. So although vascular rings make up less than 1% of all congenital cardiovascular anomalies, this is probably underestimated as some patients can be asymptomatic. And as I'm sure many of you know, it's an important diagnosis to consider and rule out in patients presenting with a variety of symptoms, which we'll get to a little later. But if you can take a step back with me for a moment to your developmental anatomy courses in medical school, you may remember that aortic sidedness and branch arteries are derived from embryonic aortic arches, which have historically been referred to as branchial arches. With that, I'll go ahead and move our model a little bit closer to us here. So this embryonic development is often modeled with uh, with a hypothetical embryonic double arch with bilateral PDAs proposed by Edwards. And as you can see here on the left, we've converted this into a 3D model, which we'll use to describe various vascular rings. So today I'm going to focus on the aortic arches that contribute to the postnatal aorta and its branch vessels. As you may remember, the first and second arches largely regress, with remnants contributing to head and neck arteries. So we will not be discussing these in significant detail. Instead, we'll go ahead and move on to the third aortic arches, which form the common carotid arteries bilaterally. And just to orient you to this model and to kind of the data sets as well, we've picked a specific color scheme which largely holds true through the entirety of this lecture series, with the aorta in red, the common carotids here in orange, subclavians in pink, the pulmonary arteries here in blue, and then the trachea and bronchi here in yellow, and the esophagus here in purple. And typically, I'll be marking the portions of the either model or data set that are abnormal in white. In this case, I've actually marked the normal structures that will regress, leading to normal aortic anatomy, which I'll get to in just a moment. And so, returning just to our aortic arches, as I mentioned, the third arches will contribute to the common carotids bilaterally. Then the fourth aortic arches contribute to a small segment of the aorta just distal to the left common carotid artery and before the left subclavian artery takeoff. So it's actually this segment right here. And it also contributes to a small portion of the proximal right subclavian over here. Mark this in pink. And then finally, the last aortic arch to contribute to the postnatal aorta is actually the sixth aortic arch, which I'll go ahead and rotate all the way around here to show you. The left sixth aortic arch forms prenatally the ductus arteriosus, and then postnatally the ligamentum arteriosum. So as you'll see in upcoming examples, vascular rings can develop secondary to persistence of structures which normally regress. For example, the persistence of a right aortic arch and a double arch. So like I said, as you can see, these structures here that I've marked in white typically regress. So I'll go ahead and remove those just to show you that obviously in typical aortic anatomy, there is no compression, right? So as you can see here, when we remove those structures that regress, although the model still shows some curvature here, you know, it'll be a little easier to see on the data set, but there's no compression of the esophagus or the trachea. So I'll go ahead and put the model back and pull forward the data set. And again, we maintained a relatively consistent color scheme here. Um, and so some important anatomic points we wanted you to understand from a normal aortic anatomy are as follows. Before I say that, the reason that this patient actually got a CT scan was because of aortic coarctation, because obviously most patients with normal aortic anatomy are not getting chest CTs, but other than the coarctation of the aorta, this patient's the spatial relationship of the structures that we're showing here is otherwise normal. So with that, I'll go ahead and move on to um, the first important point we wanted you to remember from normal aortic anatomy is that the sidedness of the aorta is defined by which bronchus the aorta passes over. So as you can see in this case, in normal aortic positioning, the aorta extends over the left bronchus, defining it as a left-sided aorta. And then the second major point we wanted you to understand spatially is to kind of understand how the pulmonary arteries um, uh, pass differently. So as you can see here, the right pulmonary artery passes underneath the aortic arch. I'll kind of rotate fully so you can appreciate that. Whereas the left pulmonary artery passes anteriorly to the descending aorta here. And so I'll go ahead and rotate this all the way around to the back so you can take a look here at the trachea and the esophagus themselves. And as you can see here, there's no tracheal compression. The esophagus is an important point to make here. In a number of our CT scans, we actually had to draw in a extension of the esophagus just because even in a normal esophagus that's not being compressed, the esophagus can be collapsed down if there's nothing extending it. So we will make sure to point out to you when there's actual compression of the esophagus from a vascular ring. And then again, as you can see here, the coarctation of the aorta is quite obvious here, just distal to the left subclavian artery. So as I kind of rotate back here to an anterior view of the structures here, I'll go ahead and point out the branch vessels before we close. But as you can see here, we actually had to extend in both the right subclavian and the right common carotid as our CT scan cut off right at the takeoff from the brachiocephalic artery. So you have the brachiocephalic here, you have the left common carotid, and then the left subclavian here. And so in future videos, like I said, we're going to be continuing to use this color scheme. So with that, we'll go ahead and pause our discussion here. In our next video, we'll be discussing the clinical presentation and workup for symptomatic vascular rings in the context of our first example of a vascular ring, the double arch. So thanks again for watching. We hope you enjoy the remainder of this video series.